Hi, it's Paul again. With the next in the series of Dancing with Cancer. I haven't really told you yet what form of cancer it is. One thing I found in the last few weeks, having been on this journey, is that everybody's afraid of that word cancer. Everybody hears it and everybody has their own view of what it is. But we forget that there are so many different kinds of cancer. I can't see past that word. Mine is oropharyngeal cancer. And from what I'm told, it's at the base of my tongue and in the tonsil tissue. I actually had my tonsils removed when I was 7 or 8, but there's still tissue there. So that's where it is. That's where my treatment will be targeted. Actually, I'll find out soon whether that's the only place it is. I already know there are some additional issues, but I'll talk about them separately. But I felt the need to tell you that now, because this particular video is going to be about dental issues. I shudder even saying the word dental, for reasons that I'll explain a little bit more shortly. But for those of you who are involved in mouth cancers, mouth, tongue, etc., etc., one thing I've discovered in the last few weeks is you're going to be going on a dental journey as well. That was a huge shock to me. I'll talk more about that in a minute, but in my first meeting with the consultants and their team at Liverpool, I was completely and utterly staggered to find out that before the cancer treatment could start, I'd have to at least be considered for serious dental treatment, if I needed any. Dead easy to hear that. For most people, I think, dentist is something people do most of the time. Routine. Lots of people don't like dentists. Some people just can't bear even the thought of dentists or dental issues or things on their teeth. Metal forks and spoons, for example. How do I know this? Because I'm one of them. I'm at the very extreme end of that. I knew that already. It's become clearer and clearer to me in the last few weeks. So I was told at that session that I'd need to be seen by a dentist who would assess what issues I had, and if there were any issues, they'd have to deal with them before any cancer treatment. And if that meant taking teeth out, that meant taking teeth out. It all seemed so matter of fact. To me, it wasn't. At the point that the specialist said that to me, they probably carried on talking about things for another 10 or 15 minutes, but I never heard a word of them. I'd already built a huge wall up in front of me that said, dental treatment, no through road. When I was very young, 7 or 8-ish, I had to have a significant amount of dental treatment done then, back in Liverpool where I was born. It didn't go well. I had the treatment under gas and air. I had massive complications, partly because of the gas and air, and partly because of issues with my teeth and how they've been dealt with. Significant pain, and thereafter a lifelong fear of the dentists. My father used to take me to a local dentist here in the Isle of Man. I was a horror patient. I know I was a horror patient because my level of fear was beyond possibility. Eventually it reached a point where that couldn't continue. And when I became an adult, I could make my own decisions. In fact, before then, in truth, I decided that I was never going to set foot in the dentist's again. About 25 years ago, I had an abscess in a tooth, and it had to be dealt with. The only way I would allow that to happen was by having a needle in my arm and being knocked out for it. Do what the hell you like with me when I'm out. So that was at least 25 years ago and was the last time I went to the dentist. I knew I had issues with my teeth. No pain or anything like that, but I knew I had issues. So when the specialist uttered those words, you're going to be going to a dentist and you can't have any cancer treatment until that's been done, it literally felt like the end of the world. My local specialist, unbeknownst to me, had already referred me to the community health centre in Douglas, where I live. And I received an appointment to go and see them a couple of days after my appointment in Liverpool. A friend offered to help, to come with me, make sure I got there, quite frankly. And she's been there along this journey with me, and I'm unbelievably grateful to her. I won't say her name because she wouldn't thank me for it, but she knows who she is, and others know as well. I wouldn't have gone otherwise. I had so many doubts going. I had my first appointment about a week ago. They just had a look. Just stepping through the door of the dentist was an unbelievable achievement for me. I was utterly terrified. When they started to have a look and poke around, I was gripped with fear. But the various staff I saw, the dental nurses, and ultimately Beverly McClung, who has taken over my treatment, have been incredible with me. Couldn't have been any kinder. Couldn't have been any more understanding. So the first session was to have a look. I was sent straight from there for an x-ray. The second session was to have a look at the x-ray. Unbelievably for me, it was decided that I didn't need to have any major treatment now. You need to be aware, by the way, that having dental treatment after radiotherapy can have significant issues. It can be far more difficult. And I won't go into the details of that because I don't understand it very well. Suffice to say, that is the case. And that's the reason why they want you to have the treatment before you have radiotherapy treatment. We discussed a plan of action. And step one was for me to attend today and have a scale and polish. For most people out there, that's so what? For me, I had gas and air. Yes, gas and air. I had dance music on in the background because they knew it would help me. It was amusing, and it did settle me down a little bit in the little bits of time where I could hear it. I didn't enjoy it, but it wasn't painful. I'm absolutely staggered that I was prepared to do it, and that's a big thanks to everybody involved. I've actually agreed to go back and have more treatment next week. Whether that happens or not, I don't know. We'll wait and see. But I'm pushing a lot of boundaries at the moment. And as my friend would say, it's good to push yourself outside your comfort zone. Usually for good things in my book. But there we go. So I just wanted to have that brief conversation about that now because it's very current. That's what's been happening to me in the last week. That's what's been happening today. Very unusually, I feel incredibly proud of myself for what I've done in the last week. So I wanted to make you aware of that. And actually, for those of you with that or similar issues or fears that are about the cancer treatment, or in my sense, not about the cancer treatment, try your best, work hard, give yourself a break, seek help, talk to people, and you can get through it. I can't even believe I'm saying that, but you can get through it. Doing what I've done in the last few days is a shock to my system, but probably the most important thing I can say about it is, it was 3 or 4 weeks ago that I was initially diagnosed with cancer. And only today, really, well, yesterday and today, certainly since I found out I didn't have to have major dental treatment, have I finally been able to let myself think about, I've got cancer, the implications of that. I'm going to be having difficult treatment. All those things I said before about being away from home, I can finally start thinking about them. Because that wall that was in between it and me has been broken down a bit. So, a bit of extra information for you, a bit more information about my journey. As ever, I'm here to talk. I'll take any questions. Like I said in the previous video, contact details will be put up there shortly. And I'm happy to help anyone if I can. So that's it for now. Signing off. Dancing with Cancer. Until the next time.